Dear friends, in this video, we are going to discuss some important spotters of upper limb. Okay, this is the first part in upper limb spotters. Okay, so before going to the spotters, let's have some basic idea. Okay, very basic idea about the upper limb, isn't it? So this is the specimen of upper limb. Okay, disarticulated upper limb specimen you are seeing, right? So this is the region called as arm, isn't it? Below the arm, we have this region called as forearm, right? And this is the hand, right? So when you see the specimen, first of all, make sure whether it is whether it is right upper limb or left upper limb. Okay. So I hope you will be knowing this is medial side, this is lateral side for this specimen or this specimen. Okay. So how I am saying this one as medial side, lateral side, at least by looking at the thumb, okay, you can confirm the side, isn't it? Thumb is located laterally and this is the little finger which is directed medially, isn't it? Fine. So you will be knowing this is the location of elbow, right? Between the arm and forearm, we have the elbow, and between the forearm and hand, we have the wrist region, wrist, right? Okay. Now, let's move to the spotters. Fine. Do you see the muscle which is pinned in this diagram, in this specimen? Yes. So can you identify the pinned structure or pinned muscle in this image? Yes. The answer is pectoralis major. Okay. Pectoralis major muscle. That is the pinned structure or pinned muscle. Okay. So origin will be from the medial side of our body and it is moving laterally. The fibers are moving laterally to get inserted into particular part of the humerus. Okay. So let's talk about the pectoralis major. So the subcosine may be attachments, that is origin insertion, or it may be nerve supply, or it may be actions. Okay. Anything can be asked as a subcosine for this pectoralis major muscle. Attachments, that is origin and insertion, then nerve supply, actions. Okay, so let's talk about it. So in this diagram, you are seeing the origin. Okay, you are seeing the origin of two heads of pectoralis major. Okay, what are the two heads of the pectoralis major? Yes, right now I am marking in red color, isn't it? This is the clavicular head, number one, clavicular head of pectoralis major. Okay, and right now I am marking the sternocostal head of the pectoralis major, number two, sternocostal head of pectoralis major. So these are the two heads of origin of pectoralis major. One is clavicular head, another one is sternocostal head. Okay, and can you see the fibers are passing laterally? Okay, laterally, and they will form one U-shaped bilaminar tendon. Okay, this is called as U-shaped bilaminar tendon. Okay, U-shaped bilaminar tendon. Okay, so that upper fibers are getting inserted into the lower part of the intertubercular sulcus of humerus, and the lower fibers, after forming the U-shaped tendon, the lower fibers are getting inserted into the upper part of the intertubercular sulcus of humerus. Okay, fine. So see this diagram again. So what is the origin of the pectoralis major as we studied just now? Clavicular head. Okay, clavicular head arises from the medial 1/3, or some books will be mentioning medial half of clavicle, whatever. Okay, medial 1/3 or medial half of clavicle bone. What about sternocostal head? Yes, it arises from the anterior surface of the sternum bone and upper 6 costal cartilages. Okay, upper 6 costal cartilages. That's why it is called as sternocostal head. Okay, and insertion, as you know, all the fibers are getting inserted into the lateral lip of intertubercular sulcus, otherwise called as lateral lip of bicipital groove of humerus bone. Okay, Intertubercular sulcus, also called as bicipital groove of humerus bone. Fine. Yes. And nerve supply, pectoralis major is supplied by medial pectoral nerve as well as lateral pectoral nerve. Okay, medial and lateral pectoral nerves. Fine. Then, what about the actions? Can you see the pectoralis major muscle is crossing the shoulder joint? It is crossing the shoulder joint on the way to get inserted into the humerus, isn't it? So it acts on shoulder joint. Pectoralis major muscle acts on shoulder joint. Since the muscle is crossing the shoulder joint anteriorly, okay, since the muscle crosses the shoulder joint anteriorly, okay, it causes flexion of shoulder joint. That is the main action. Flexion of shoulder joint, otherwise you can say flexion of arm, whatever. Then it also causes adduction of shoulder joint. Okay, adduction, that means towards the body. Okay, adduction of shoulder joint, and it also causes medial rotation of shoulder joint. So these are the three actions of pectoralis major muscle: flexion of shoulder joint, adduction of shoulder joint, and medial rotation of shoulder joint. Fine. So I hope you are clear about the origin, insertion, nerve supply, and actions of pectoralis major muscle. Right. Let's move to the second Sparta question. Can you identify the muscle pinned in this specimen? Yes, this is the deltoid muscle. Deltoid muscle has been pinned. Okay. In the first Sparta question, we have see this muscle has been pinned. That is pectoralis major, right? Now this muscle, we are talking about this one, this muscle. Okay. Origin will be like this. It is having a wide origin. Okay. And all the fibers of this muscle, they are converging. They are converging to get inserted into one particular point of the humerus bone. Okay. Called as deltoid tuberosity of humerus. So please make sure you are able to identify the muscle. Okay. So deltoid muscle is pinned. Okay. Fine. So what are the subquestions? So please take care. Deltoid muscle is an important short notes in theory exam also. Okay. It is an important short notes. They may ask the deltoid muscle and the structures under cover of deltoid muscle. Okay. So let's talk about all the things about the deltoid muscle. Okay. I hope you will be knowing deltoid is the muscle which forms the shoulder region. Okay. It is the muscle which forms the shoulder region. Okay. Fine. So as you see in this diagram, the origin of deltoid muscle is by three sets of fibers. Three sets of fibers. What are they? Anterior fibers. So in this diagram, you will be knowing the orientation which is anterior posterior in this diagram, isn't it? So right now I am marking the anterior fibers of deltoid. Okay, this one, anterior fibers of deltoid. Right now I am marking the middle fibers, also known as acromial fibers or lateral fibers, whatever, all are same. Okay, middle or acromial or lateral fibers. Right now I am marking the posterior fibers of deltoid. Okay, so according to the site of origin, there are three sets of fibers of deltoid: anterior fibers, middle or lateral or acromial fibers, and the posterior fibers. Okay, so what is the site of origin of all the three sets of fibers? Yes, anterior fibers arise from the lateral 1/3 of the clavicle bone. Lateral 1/3 of the clavicle bone, and acromial fibers, they are named because they arise from the acromion process of the scapula. Acromion process of scapula bone, and the posterior fibers, they arise from the spine or spinous process of scapula. Spine or spinous process of scapula, right? And as I told already, all these fibers, they are having wide origin, but they are having very narrow insertion into the deltoid tuberosity of humerus bone. Deltoid tuberosity of humerus bone. And what is the shape of the deltoid tuberosity of humerus bone? Is V-shaped. Okay. So the fibers are getting inserted into the V-shaped deltoid tuberosity of humerus bone. Fine. And please remember, out of these three sets of fibers, anterior fibers and posterior fibers, both are unipinnate fibers. Both are unipinnate fibers, What about the middle or acromial fibers? Yes, they are multipinnate fibers. They are multipinnate fibers. Okay. So what is the importance? The strongest fibers of deltoid is but middle fibers, that is acromial fibers, also called as lateral fibers. I told you the middle fibers are directed laterally, isn't it? So they are called as lateral fibers, and according to the site of origin, they are also called as acromial fibers. Okay, fine. Now coming to the nerve supply, followed by origin and insertion. Let's talk about the nerve supply. This is a very commonly asked spotter sub question. Okay, mostly they will be asking the nerve supply of the pinned structure. Okay, so deltoid is supplied by axillary nerve. Yes, deltoid is supplied by axillary nerve. The root value of axillary nerve is C5, C6. Right. Coming to the actions of the deltoid muscle. Okay, all the three fibers, sets of fibers of deltoid, they have different action. Okay, anterior fibers cause flexion and the medial rotation of shoulder joint. Middle fibers or acromial or lateral fibers, they are located laterally, right? So when they contract, they will cause lateral movement of the shoulder joint. What is the lateral movement of the shoulder joint called as? Away from the midline? Exactly, abduction of shoulder joint. Okay, specifically it causes 15 to 90 degree rotation, 15 to 90 degree abduction of shoulder joint, 15 to 90 degree abduction of shoulder joint. And posterior fibers, just opposite to the anterior fibers, they cause extension and lateral rotation of shoulder joint. Okay, so this is about the actions of deltoid muscle. All the three sets of fibers, they have different actions. Okay, almost all the movements of shoulder joint are performed by the various fibers of deltoid. Okay, fine. Now, so I humbly request you to practice this simple diagram. Okay, since this is an important short notes. Okay, fine. Okay. So coming to the applied aspect of the deltoid muscle, you know the applied aspect. What? The clinical importance of deltoid muscle is intramuscular injection, IM injection. So intramuscular injection is given in the lower part of deltoid. Okay, why it is given in the lower part of deltoid? Yes, in order to avoid injury to the axillary nerve. Okay, in order to avoid injury to axillary nerve, always IM injection, intramuscular injection is given in the lower part of deltoid muscle. Fine. Yes. Now let's talk about the structures under cover of deltoid. Okay, fine. So what are the bones which are under cover of the deltoid muscle? In the scapula bone, the coracoid process, and in the humerus bone, the greater and the lesser tubercles of humerus. Okay, these are the important bony landmarks which are under cover of deltoid muscle. Okay, coracoid process of scapula, greater and the lesser tubercles of humerus bone. Fine. Then, so whatever the muscles which are getting attached to this particular bony landmarks, they will be obviously under cover of deltoid. Okay, so I hope you know the three muscles which are attached to the coracoid process of scapula. What are they? Yes, pectoralis minor, Coracobrachialis, and short head of Biceps Brachii. These are the three muscles which are attached to coracoid process of scapula, and you will be knowing that three muscles which are getting inserted into greater tubercle of humerus, sit muscles. You know the sit muscles, right? Supraspinatus, infraspinatus, and teres minor. Teres minor. Okay, simply called the sit muscles. They are getting inserted into the, yes, attached to the greater tubercle. And what is the only muscle getting inserted or attached to the lesser tubercle of humerus? Yes, it is subscapularis. Subscapularis. Okay, fine. So all the various muscles which are attached to the coracoid process of scapula, greater tubercle and lesser tubercle of humerus, they will be obviously under cover of deltoid. Okay. Then coming to the blood vessels and nerves, okay, which are under cover of deltoid. Okay, you know the surgical neck of humerus, right? What are the blood vessels and nerve which will wind around the surgical neck of humerus? Yes, the nerve is axillary nerve, and the blood vessels are anterior and posterior circumflex humeral vessels. anterior and posterior circumflex humeral vessels or arteries, whatever. Okay. So I hope you are clear about the structures which are under cover of deltoid. Some other structures may be given in your textbooks, but these are the main structures. Okay. Bony landmarks, muscles, blood vessels, and nerves. Fine. Yes. Let's move to the next spotter question. Okay. Any idea about the muscle pinned in this image? What is the muscle pinned in this image? Yes, this is the biceps brachii muscle. Okay. So the muscle pinned, okay, is biceps brachii. Biceps brachii. Okay. Fine. So how I am saying this one as biceps brachii muscle, because if you trace this muscle upwards, are you able to see the two heads of the biceps brachii? One is this one, another one is this one. Okay. So these are the two heads of the biceps brachii muscle. Okay. So the subcosine may be origin, insertion, that is attachments, or nerve supply, or action. Okay. Fine. And do you see the muscle is running like this? And finally, the tendon of biceps brachii, okay, tendon of biceps brachii will get inserted. Okay, this is the tendon of biceps brachii. So I have marked the two heads of the biceps brachii, isn't it? This is the long head of biceps brachii. This is the short head of biceps brachii. So they have different sites of origin, but finally they will form one tendon which is getting inserted. Okay. Into the radial tuberosity. Fine. Okay. So let's talk about the biceps brachii muscle. Okay. See, not only biceps brachii muscle. See this diagram. See this diagram. See this specimen. Okay. Here the biceps brachii muscle has been reflected. Okay. Biceps brachii muscle has been reflected. Okay. And they have pinned one muscle which is just deep to the biceps brachii muscle, okay, and which is present only in the lower part of the arm, which is present only in the lower part of the arm. Any idea about the muscle I'm talking about? The pinned muscle here. Yes, this is the brachialis muscle. Brachialis muscle, okay. And one more possible muscle that can be pinned in the front of arm is the muscle I am marking now. Any idea? Which is present only in the upper part of arm, which is present only in the upper part of arm. Yes, which muscle I'm talking about? Exactly, Coracobrachialis. Okay, so biceps brachii, then brachialis, then Coracobrachialis. This muscle I am talking about. This muscle, only this much. This is the site of origin, and the fibers are getting inserted somewhere here. Okay, origin and the insertion of Coracobrachialis. Okay. So in this diagram, you know, this is medial side, this is lateral side. Okay. Actually, this is the deltoid muscle, which is reflected laterally, Okay. Fine. So all these three muscles of the front of arm, okay, any muscle can be pinned. Okay. So let's talk about the origin, insertion, nerve supply, and actions of the three muscles of the front of arm. You will be knowing the front of arm is otherwise called as flexor compartment of arm, okay, because these muscles will cause flexion movement, okay. And all these three muscles, if you consider in short form, you can make it as BBC, biceps brachii, brachialis, coracobrachialis. All these three muscles, BBC muscles, are supplied by MC. BBC are supplied by MC. What is the nerve I have written as MC in short form? Yes, it is musculocutaneous nerve. Okay, musculocutaneous nerve. Fine. So take care of the three muscles of the front of arm or flexor compartment of arm: biceps brachii, brachialis, and coracobrachialis. Fine. So you should be able to identify the muscle, which muscle is pinned. Okay, in the specimen spotters. Fine. Fine. If you see this diagram, you can understand. This is the coracoid process of scapula. This white color area is the coracoid process of scapula. Okay. In this diagram, this is medial side, this is lateral side for the arm, isn't it? So, do you see the green color structure which arises from the coracoid process of the scapula? Yes, it is nothing but coracobrachialis, green color structure, isn't it? Then, what is the one more muscle having common origin along with coracobrachialis? From the coracoid process? Yes, it is short head of biceps brachii. Fine. And as you see in this diagram very clearly, The coracobrachialis muscle, after arising from coracoid process, it is getting inserted into the medial aspect of the middle of the shaft of the humerus. Okay, medial aspect or medial side of the mid shaft of humerus, middle of shaft of humerus. Fine. Then, what about the short head? After arising from the coracoid process, it joins with the long head of biceps brachii. Okay, it joins with the long head of biceps brachii to form the muscle. Okay, to form the muscle belly, and finally, as I told, the tendon of biceps brachii will get inserted into the radial tuberosity. The tendon of biceps brachii will finally get inserted into the radial tuberosity. Okay, fine. And what is the site of origin of long head of biceps brachii? Yes, it arises from the supraglenoid tubercle of scapula. It arises from the supraglenoid tubercle of scapula bone. Okay, fine. Now, and listen, in short notes also, biceps brachii or brachialis or coracobrachialis you can expect in short notes, theory exam. Okay, so take care of each and every point we are discussing now. Okay, regarding these muscles. Fine. And do you see the blue color muscle marked in blue color in this diagram? The one I am marking now. Okay, this is the brachialis muscle. Okay, brachialis. Okay, so this is the site of origin of the brachialis. Where it arises? Yes, it arises from the lower part or lower half, whatever, lower part or lower half of shaft of humerus. Okay, from the anterior aspect. Okay, from the lower half of the shaft of the humerus anteriorly, and after crossing the elbow joint, this brachialis muscle is getting inserted into the coronoid process of ulna. Okay, coronoid process of ulna. So this diagram shows the origin and the insertion of all the three muscles of the front of arm: biceps brachii, brachialis, and coracobrachialis. Fine. Okay. So if you see this slide, again, other than origin and the insertion of the three muscles of front of arm, you are able to see also the nerve supply and actions, which we have to take care also. Okay, we have to take care. Fine. As I told already, all these three muscles of the front of arm are supplied by musculocutaneous nerve. Okay, all are supplied by musculocutaneous nerve. And if you see the brachialis muscle, it not only supplied by musculocutaneous nerve, it is also supplied by radial nerve. That's why I have written here, brachialis is a hybrid muscle. Otherwise called as composite muscle. What do you mean by hybrid muscle or composite muscle? Yes, muscle which is supplied by two different nerves. Okay, dual nerve supply. Okay, muscle which is supplied by two different nerves will be called as hybrid muscles or composite muscles. Example is brachialis because it is supplied by musculocutaneous nerve and radial nerve. Fine. Okay. Now coming to the actions of the three muscles of the front of arm, biceps brachii, okay, causes flexion. Why it is called as flexor compartment? Because all these three muscles, they will be having the common action of flexion. And in which joint they cause flexion, that we have to keep in mind. Okay. So biceps brachii crosses the shoulder joint as well as elbow joint. Okay. So it causes flexion of both shoulder joint and elbow joint. But brachialis is crossing only the elbow joint. Okay, so it causes flexion of only the elbow joint. What about the coracobrachialis? You know, coracobrachialis crosses only the shoulder joint. Okay, it is not crossing the elbow joint, right? So it causes flexion of shoulder joint only. Okay, so try to understand. If you know the origin and insertion, which joints are crossed by the particular muscle, you can easily say action on which joint that muscle can act. Okay. Also, although I have told you biceps brachii causes flexion of both the shoulder joint and elbow joint, the main action of biceps brachii is supination of forearm. The main action of biceps brachii muscle is supination of forearm. Okay. Fine. Take care of this very important point. Yes, we have talked about the origin, insertion, nerve supply, and action of what? All the three muscles of front of forearm. Okay. Anything may be asked as a sub question for all these three muscles. Okay. Yes. So here I have, this is the same image only, but magnified view. Okay. So you are seeing the coracobrachialis muscle here. You are seeing the coracobrachialis muscle pinned. The previous image also you have seen the same muscle pinned. Okay. But this is the magnified view. Fine. Yes. That's the end of the upper limb part 1 session. Thank you all. Thank you all.